We see improvements in speed, efficiency, accuracy of surgery, and premium lens conversion rate, all just by using VERACITY, things that we did not know we were going to get when we implemented the technology.
Everything is done at the time of the consult. I will go in theater. I know the correct data is there, safety is there, precision is there. That gives me consistent results. I'm happy, my patients are happy, my staff is happy, and that builds the practice. I'm Smeta Agarwal. I always wanted to be a surgeon, but I also wanted good work and life balance in my life. We are very lucky and blessed to be in Wollongong because it's such a beautiful town surrounded by mountains and sea. It is an Aboriginal word and its meaning is sounds of the sea. I really love the community over here. It's like a big close community. I set up my first practice in 2009 and then moved on to set up the third practice in Wollongong. We are a high volume practice and I perform 40 to 50 cataract surgeries every week. I'm a very big fan of technology because I can only enhance my efficiency and performance by the use of technology, I feel. All my equipment is digitally connected, so all the tests which are done by my clinical staff, they get transported electronically on my computer. So I got EQ Workplace this year, and when I started using, when I saw the functionality, I was amazed. I was so happy that all the formulae which I need are there on EQ Workplace. I think my staff is a lot younger than me, and they are born with iPads and technology, so they love the technology. They love working with me because they don't have to print papers. They just send everything electronically to me. It is faster for them and easier for them.
And have a blink. Eyes open. What I like about the IOL Master, on top of being easy for the patients, it's very fast to use. It gives some reliable results. It's very good with its axial length at getting through some of the denser cataracts. And it has some excellent keratotomy, which is amazing for calculating our toric lenses.
Come on in, please. So I believe in giving good care to the patients. I talk to them about their lifestyle, about their needs, and then I look at their eye, ocular anatomy, look at their IOL master, look at their corneal topography. So they are very well informed and they get what they are expecting. So yes, you do have a cataract in your eyes, and it's a type of a cataract which affects your vision, especially at night time, gives you a lot of glare. It is so much better for the patients to watch exactly what is happening in their eyes and what solutions, what results they're going to get after their surgery. So it looks like you've had laser done, and you told me that you were short-sighted before the surgery, and because you've got a bit of astigmatism, so I'll probably use a lens which corrects your astigmatism as well. So I'll just do the planning. It looks like I'll go for 80 Lisa lens. Well, having that digital surgery planner is good. I'm a control freak. I like to be 100% sure, give them precision, give them perfect results. So with that EQ Workplace, when I'm doing the planning, I know everything is perfect. With the digital workflow, I'm saving about 10 to 12 minutes per procedure. My results are consistent with the published studies by my peers. So I think for my practice, EQ Workplace is a really good blessing for me.
I've actually grown up in the Philadelphia area. As long as I've been trying, I can't escape. My plan was to finish my education and maybe go to New England or go out to Colorado, but I just keep getting drawn back to the Philadelphia area. I serve as a referral source for complex anterior segment surgery. We absolutely can't fix everybody. There are some problems that don't have solutions, but if there's any way that we can find for a patient to do better or see better, we're gonna do it. And I sleep pretty well at night knowing that I'm trying to help as many patients as I can during the day. We have to go in, free that lens of any scar tissue. I have to actually cut the lens into small pieces so I can take it. So on average, we're seeing about 150 to 200 patients a week, and we're doing between 25 and 40 surgical cases per week. And to try and fit that all into a week, you need to find either 25 hours in the day or 8 days in the week. And since that's impossible, you got to just fit more into the time you have. And so that's where trying to be as efficient as possible is really, really important. They were both for distance?
Right.
And we've implemented the VERACITY surgery planner, years ago, and instantly I could see a difference in workflow in the office and in the operating room, and it is an essential part of what I do every day. I can't function at this point without it. So I'm not only a believer, I'm a user of the technology.
Hi, how are you today?
Good, thanks. I'm here for an appointment with Dr. Ayres.
One of the
Okay.
best
What's
things
your name?
about this advanced technology, whether it's our biometer, our camera, or the OCT, is its ability to communicate with the VERACITY surgery planner that I don't have to go get this data and import it. It seamlessly integrates to my tablet. And I should say that I carry my tablet with me all the time. Every patient I see, I walk into the room, I open up my tablet, put the patient information in, and all that data flows right to me. So I can spend more time looking at the patient and talking to the patient, a lot less time trying to gather data and bring it all into one place. So what makes this really work, it's not the instruments, it's that seamless flow of data to my tablet. So one of the things that we want to know when we're talking about cataract surgery is really what you're looking for your vision after that surgery. We've already got great measurements on you. You can see here, you went through our IOL master, which really is the measuring stick, if you will, for cataract surgery. It looks at the curvature of your cornea, and you did great. I can show you a couple pictures of that. Essentially, I use the VERACITY surgery planner right in the room in front of the patient, because I want to make my implant and my cataract decisions and other surgical decisions while I'm there. I don't want to be doing this at home when I could be spending time with family or friends or whatever the case may be. This is all done by math, and the math is all done for us right here. So in your case, you would be a great candidate for either a standard lens where you would still need some reading glasses, or if you wanted to, given the health of the rest of the eye, you could upgrade to something like a trifocal lens or a extended depth of focus lens, and that would decrease your need for glasses after surgery. So not only would your distance vision be good, but you'd probably also to function very well up close without having to put the cheaters on.
Which would be perfect because these are progressives, so I would like something that
Similar idea. It
covers
really
both.
would free you up from needing those glasses, and then we can just simply look at the other eye as well. And patients see how we make these decisions and the formulas that we use, and it demystifies it a little bit for those patients. So they become more involved in the decision making as to what implant they want, and we found a definite improvement or uptick in conversion to premium lenses. But since VERACITY is a growing, kind of breathing project, it changes. As new formulas come out, those formulas become available on VERACITY, including the ZEISS AI formula. The ZEISS AI calculator also optimizes per IOL and IOL design. This is unique to every single implant in that formula. And I remember 5-6 years ago going home and sitting down at my computer, going through my list of surgery and spending easily 30 or 40 minutes per day revising lens calculations. And that gets replaced by a click of my finger with the VERACITY surgery planner. And again, all of this is through wireless technology and data flow, so there's no room for transcription errors. And transcription errors can be a major problem when we're talking about toric IOLs and even safety for surgery. This is now a thing of the past. We've got our image, it flows with us, the data flows with us to the operating room, and now we're operating in that digital environment on patients every day.
So far it's going good. Everything is all pre-populated. I don't have to worry about. All the lenses are in order. Everything is worked on the surgery planner and EQ workplace. So I really don't have to worry about anything now. I just have to go and operate. So instead of asking my nurses to do this step, I've got everything on my fingertips on my Lumira microscope. I press, it determines the axis, and if I think it is looking pretty good comparing the blood vessels, I say okay and move on to show the size of where the incision alignment is. It is showing 42 degrees. It is perfect. We are ready to start. This is a 4+ dense cataract in a young gentleman who's 49-year-old. So this bit of high vacuum with Cataract is really beautiful. I really love it because the pieces come straight into my phaco handpiece without losing the anterior chamber stability. And it's all done. So he's ready for implantation. So I'm preparing the lens now. 80 Lisa Tri-Toric. The lens is beautifully placed. I'll check one more time under the microscope to make sure that everything is good. It's looking really well placed. I'll close the cover. And it's ready to go now. See the lens moving forwards in the cartridge now, and we are ready. That's the lens being delivered into the anterior chamber. And there are 2 markings. And I'll rotate the lens to align with these markings. So before markerless system was there, my anesthetist would be marking with an ink pen, and each ink dot would be about 5 degrees, and we all know that you lose 1% of astigmatism, I think. So with markerless, because it is all proper alignment, the accuracy is there, patients, I'm getting better outcomes. So it's looking really good now. It is aligned, those 2 lines to the alignment axis at 42 degrees. Gives me mental peace of mind that the lens is properly aligned and patients will be happy next day. So Shannon, it's all done, all gone really well. Very good, Shannon, you did really well.
Most of the cataract is out, okay? We're gonna take the last little bits out and then we gotta get the implant in. So in these complex cases, the fluidics mean more than ever. We don't want a real bouncy anterior chamber. We just want nice, smooth phaco. So there we go. Nice, stable anterior chamber, even with high flow rates. This is great. This machine is really nice. Okay, we'll take our IOL. The CT Lucia is a beautiful implant in the eye. So from the surgeon experience, it inserts nicely, it unfolds well, and it has a very broad haptic optic junction, which makes it a more stable lens in the eye. Now, the visions that we're getting with the CT Lucia are superior. Patients are very happy. 20/20 vision, even post-operative day 1. Surgery's almost done. You've done really well. We got exactly what we wanted. Okay, you made it. I love digital technology. I love the digital flow of information from the office, diagnostics to me, and then flowing even into the operating room now. And that's done better when we work together with industry and physician in the operating room. That's innovation.
My successful day is I love operating. So I enter into the OT room and everybody is happy, smiling, flawless surgeries, giving consistent results, efficiently, having no stress anywhere, happy patients, happy staff, happy doctor. And that builds the practice.